Hello. Today I'm going to talk to you about how to interpret your MRI report. I get so many patients that say to me, well, my doctor said there's nothing wrong with me, but I have so much pain. Or, gosh, you need surgery. This doesn't look good. Whichever end of the spectrum you're on, it can be very intimidating to not really understand what is going on and what those big words are. So a lot of times those people come to me, and I look at their MRI report and we go over what those big words mean and I give a visual demonstration and they're like, okay, that makes sense. And then we can coordinate that with the right exercises to do to try to combat whatever it is that's going on there in your MRI report. So today I've got my handy dandy lumbar spine model and we'll use that to go over some of those big words. And I've made a list of some of those things that usually pop up that people have questions about. So very commonly, you'll see something on your MRI report that says degenerative disc disease, DDD, or degenerative joint disease, DJD. So we're talking about, well, here's the disc. In this model, it's represented by a clear, juicy, squishy kind of thing. So like a stress ball consistency is kind of how I describe it. And you'll get a disc in between each and every one of your lumbar vertebrae. And those vertebrae, that's the bone part. And in the lumbar spine, or in the lower back, you have 5 of those. So if they're talking about L4, L5, or L5S1 disc, for example, so if here's lumbar vertebrae 1, 2, 3, 4, 5, if they talk about your L4, L5 disc, they're talking about that one that's in between those 2 bones. Or your L5S1, so the S stands for the sacrum, and the disc that's in between those, they can identify which level is giving you your problem, or which levels perhaps, and that also correlates with the nerves that come out. So the nerve that comes out of the one way up here at L1, that goes more down to your quad or the front of your thigh, whereas and then there's various down there in L5, that's kind of the one that goes way down towards your big toe. So we can kind of tell, oh yeah, that explains why you're having pain in that area. It's because you've got a disc problem in that area at your spinal level. So anyway, so this degenerative disc disease, they might describe it in 3 different categories: mild, moderate, or severe. And just as those words suggest, there's different degrees of how intense that degeneration is. Degeneration, arthritis, kind of the same idea. So as they're looking at the MRI, if there's a degenerative nature about your disc, it might be a little more squished together. They won't see it spread out as far in between the bones. It'll kind of be flatter. It won't have as much viscosity or juiciness or cushion for it. Mild means you're probably not really getting your pain from that. It's probably more like a muscle issue. Moderate, it might be an issue there at the bone. Severe, and doctors start scratching their heads and wondering if you're going to be needing like a surgery to help clean that up. The surface along the bottom of the bone or the top of the bone, that also might be compromised and kind of be rough. Stalactites, stalagmites, that kind of idea with, it's just not a smooth surface. So any kind of compression that you add to all that, from having tight muscles or slouching with bad posture, that's going to intensify that arthritis or degeneration that's going on. Loosening those muscles and having good posture will mean you'll have less symptoms from that diagnosis. Herniated discs, bulging disc, ruptured disc, all those things, for the most part, interchangeable terms. On our model here, they're representing it with a little red dot. So the disc is considered herniated or bulging out when it's gotten squished and it kind of pushes outside its nice circle shape that it has. So I like to liken this to eating a jelly donut. What happens if you bite on one end of the donut, the jelly kind of squishes out the back end. So if you're slouching, sneezing or coughing, whiplash injury, lifting incorrectly with bad form, those things can all put pressure around that disc. It's like your disc has a rubber band around it. And every time you bend or twist or squeeze, that rubber band just kind of stretches. Normally that's fine. It holds that shape and it goes back to that shape. But when you wear out that nice rubber band, essentially, that's around your disc, and when that gets loose, just like a rubber band would, it could get loose, it could eventually break. don't think of it quite like that, but that's when you end up with that herniated disc, when that part of that disc stays squished and squeezed out. It pushes out of the area it's supposed to be in, where it's supposed to give you nice cushion and support of your spine, and it pushes into the area where the nerves are. And that's where you get that radiating pain and those symptoms and that, the pain. So that's kind of how I describe a herniated disc. Spinal stenosis is another common diagnosis that you'd be able to determine you have from either an x-ray or an MRI. And so our spinal column, let's call it a circle, where the nerves, the big nerve cord, the spinal cord, goes down through. And when that circle, say it's supposed to be this big, if that circle is filled with degeneration or arthritis or swelling, inflammation, it's going to make that area more narrow. And that's when you get the diagnosis, spinal stenosis. And that means that that nerve, that big bundle of nerves that are trying to go through there, your spinal cord, it doesn't have as much room. So you're going to be more vulnerable to, slouching, or if you're in that wrong position, or sudden movements. A lot of times people with spinal stenosis will tell me that, well, I can walk not very far, and boy, I just need to sit down. And then once I sit down, my pain goes away. Then I'm okay to get back up and do a little bit more walking, though I tend to feel better if I'm hunched forward. That's a pretty classical description of the symptoms of someone with spinal stenosis. But with proper physical therapy, with good posture, with stretching the muscles along the back of your spine and strengthening the ones in the front, your core, that can help you to mitigate the typical symptoms that you're going to get from that diagnosis. Another common diagnosis that I hear about and try to explain, is foraminal narrowing. So the foraminal area, that is basically, again, like a circle, a space where the nerves come out the side of your spinal cord. So as the lumbar vertebrae stack up against each other, they create an opening in there where that nerve can come out. And it's when that opening narrows down, again, because of inflammation or scar tissue or swelling, stuff like that, arthritis, that it narrows that area, giving your nerve less room to get out of there and to innervate your body. So again, you're getting pain and you're getting those radiating symptoms too, perhaps. Nerve root encroachment. Encroachment is like getting pinched off or squeezed down, and the nerve root here happens right at where the nerve exits the spinal cord area, and if that's getting pinched, you'll be feeling those symptoms throughout your body too. So that's just a few quick little things as to how to interpret your MRI reports. If there's any other words that have come up and you would like for me to go over, I'd be happy to. Send me a message. And also, probably most importantly, the reason why we interpret those things is so that we know what steps we need to take for treatment. So if you've got any of those things going on your MRI report, please reach out to me, let me know, and we'll find the right exercises for you to help you to feel better. Have a great day. Thanks for listening in.